Hello, my name is Dr. Christopher Anderson. I am the current headache medicine fellow at Mayo Clinic in Scottsdale, Arizona. I had the pleasure to participate in the Act Now program for fellows and advocates during this past academic year and wanted to share some information about our new device trial that we're currently working on using the funds generated by Miles for Migraine Advocacy. One of the current treatments that we have available for chronic migraine, which is migraine occurring on 15 or more days per month, is Botox. And when we order Botox, we typically start at 155 units that's injected in 31 injection sites around the head and neck, and then is repeated every 3 months or every 12 weeks. And the effect is cumulative over time, so people will often come back for multiple procedures. Because the procedure involves so many injections, it can be painful for some people, and there's no easy way to reduce that pain because essentially it would just mean more injections. Because you wouldn't feasibly be able to inject lidocaine before each injection, because then you would just double the injections. So one thing that we're interested in doing is trying a device called Nerivio, which has been cleared by the FDA for both rescue and preventive treatment and migraine. And it is an electronic device that is secured to a patient's arm and is controlled by a smartphone. And typically it is worn for about 40 minutes for full treatment effect, which is thought to involve the activation of the brain's own sort of pain-killing mechanism within that time frame. Now, we have some reason to believe that this device may also be beneficial for what we call acute procedural pain, or pain experienced from procedures like needle sticks or like Botox. And we've actually started enrolling patients aged 18 to 75 who are undergoing the Botox procedure to be randomized to receive either the active or real Nervio device versus a sham or a device that looks just like it. It feels like the real device, but it's not the real device. And then when they come back for their second appointment or their next appointment, they'll cross over to receive the alternate device and then essentially compare it against themselves to see whether or not the device helps reduce the procedural pain. And so we're currently about a quarter of the way through our intended recruitment target, and our project would not have been possible without the funds generated by our advocates at Miles for Migraine. So I'd like to extend a big thank you to all of you who contribute to their events, and we really appreciate it over here. Thanks.